Welcome. My name is Ed Ayala Jr. Today I'm going to educate you about the importance of infection prevention when inspecting or working above the ceiling in a healthcare setting at the Queen's Medical Center. We restrict who goes in our ceilings for a number of reasons, but primarily it is for the safety of our patients, which is why ceiling access requires an above-ceiling permit. What are the risks of working above the ceiling? The first thing you may think about when it comes to safety and above-ceiling work is someone falling through the ceiling or a ladder. We do worry and care for your safety. But a bigger risk to our patients is the unseen risk fungi, more commonly known as mold, thrives in dark human places like spaces above ceilings and inside of walls. In healthcare-related construction activities, there are generally three types of fungi that we are concerned about: Aspergillus, Rhizopus, and Mucor. I'm primarily going to discuss Aspergillus. So what is it? It's a mold that is common outside, especially in soil and decaying leaves. It can also be found inside, particularly in areas that can be moist, like inside walls and spaces above ceilings. Most people breathe in spores every day without getting sick. However, people with weakened immunity or lung diseases are at a higher risk for developing health problems or dying due to Aspergillus. Health problems can include allergic reactions, infection on skin, and other organ infections. Here we see a picture of Aspergillus taken with a special microscope. Up close it looks beautiful, but to the human eye it looks like a black or brown growth, which we see here on the right, on the ceiling, tile, and wall that has had water intrusion. Remember, just because you can't see it doesn't mean it's not there. Why do we care about mold in healthcare facilities? Patient safety is why. Here are two news articles. One from 2009 that states 3 young cancer patients died within a month of one another at the same hospital. Cancer didn't kill these kids. It was mold released during a construction project that killed them. A news article from 2017 references 6 deaths at a hospital from mold trace to hospital linens. While this was not due to construction, the effect was the same. Multiple patients died from exposure to mold in the healthcare setting. So what are the chances of this happening? Were these deaths in the news, rare events? I wanted to find this out. I have found many published papers on fungal outbreaks in hospitals due to construction and renovation. These published findings in the Journal of Clinical Infectious Diseases. I have found a surprising number of documented yet preventable mold-related deaths from healthcare-related construction and renovation projects. I selected 2 to show you why infection prevention measures are important in healthcare settings. The first example, circled in red, kidney transplant patients, 3 infected. 1 died due to mold spores on dust released from the false ceiling and transplant unit. Premature infants, 2 infected and both died. Again due to mold release from a wall renovation and work above of the false ceiling. Over 40 years, there have been 49 published articles about infections and deaths during hospital construction renovation and demolition projects. It is estimated that about 5,000 patients a year become infected in healthcare settings. The mortality rate from construction-related infection is a staggering 55% even with treatment. In the healthcare environment, here is the areas that have the highest risk. While we think of ourselves as a community hospital, the Queen's Medical Center is more than that. We are a Level 1 trauma center ranked as one of the top 100 hospitals in America. People come from all over for treatment here. Every patient population considered at highest risk for construction-related mold infections are being treated at Queen's Medical Center. Here is a patient that developed sores on her skin. It was found that the sores on this patient's skin was an infection that was caused by mold growth inside of the wall of this patient's room from a leaking pipe. With the weak immune system, infection spread quickly in a matter of days. It was in her lungs and then her brain, and she died. I said earlier that mold is common. So how do we protect our patients in the hospital? There are many ways. We use high-efficiency particulate air filtration, known more commonly as HEPA filtration. If you listen closely in our facilities, you might hear our air conditioning, fans running constantly. It rapidly filters the air to pull any microorganisms out of our patient areas. In the operating rooms and over the beds of our highest-risk patients, we exchange the air 12 or more times per hour. We also direct filtered air down over the patient to try to push away microorganisms floating on the air. Windows shouldn't be open as it bypasses the filtration process. We want patients to have filtered air, especially in our highest risk units. Doors should not be propped open for infection prevention and other safety reasons. We require above-ceiling permits so we know who is in our ceilings and where they are working. We expect our staff and contractors to use barriers or infection control booths when opening ceilings and highest risk areas. We also expect our staffing, contractors, to follow our policies. These rules and requirements are not in place to make your work difficult. It is for the safety of our staff and patients. It is for the safety of our patients. Patients depend on you to help protect them from construction-related mold. Being sick is challenging enough without having to worry about maintenance staff and contractors working nearby. These people are our mothers, spouses, children, friends, and neighbors. And sometimes you and I are also the patient, and we need protecting as well. It's important to educate ourselves and our coworkers about the risk of not using proper infection prevention measures. Other reasons we require an above-ceiling work permit. Maintaining a safe environment in our hospital. The Queen's Medical Center are obligated to comply with local, state, and federal regulations. To maintain standards and regulations, we aim at ensuring we deliver high-quality care. Here are the top-cited life safety findings found above the ceiling at the Queen's Medical Center. Sprinkler pipe systems are not to be used to support any other items. Here are some observations that are not allowed. Wires that are draped over sprinkler pipes. Ductwork leaning on pipes. Ceiling grid hung from pipes. Here are some examples. These photos are actual findings here at the Queen's Medical Center. Another finding we find are the spaces around pipes, conduits, air ducts, cables, wires, pneumatic tubes penetration the walls or floors are protected with an approved fire-rated material. Here in this picture, you'll see mixed fire stopping with red and yellow. There are many different manufacturers of fire-stopping materials. You cannot mix manufacturer A with manufacturer B because there is no Underwriters Lab listing that type. Here in this examples, you'll see scab patches, mixed fire-stopping materials, and holes. Everything you do above the ceiling on a firewall has to be Underwriters Lab listed. Per policy, we have standardized the types of fire stopping that is allowed and must be approved by Facilities Building Services. Why do we require containment in our highest risk areas? If you are just pulling cable or doing other small activities. Because mold spores are microscopic, and something as simple as pulling a cable can cause a mold spores to go airborne. How do you, as a contractor or a maintenance person, protect our patients? There are several options. One is the use of an infection control containment cube. These infection control containment cube goes by many different names, but is a mobile infection control system. Before removing a ceiling tile, be sure. Door is closed. Curtain is flush with the ceiling. HEPA machine is plugged in and running. When being mobile, always lower the curtain to prevent snapping off a sprinkler head. And dirty water is a whole different infection risk. This is what happens when you don't lower the curtain. Needless to say, it creates a mess very quickly. Ideally, you would think you could use the infection control booth anywhere, but at times the fancy designs of hanging lights and different types of ceilings, this may prevent the booth working. If this occurs, we expect you to use a temporary barrier. Fire retardant Visqueen sheeting should go from the floor to the ceiling and have a portable recirculating HEPA machine inside. Contact engineering or infection prevention if you are not sure what to do. The key important items to remember are: an above-ceiling work permit is required to access spaces for above-ceiling work. Infection control containment such as HEPA carts and fire-retardant plastic barriers is required in the highest risk areas. No above-ceiling work should be done while a patient is in the room. Do not leave ceiling tiles out when you are not working or at break and lunch. Debris and dust that falls on the floors or handrails should be vacuumed, wiped, or mopped up when the work is finished. If you don't know the right thing to do, ask.